I'm an obstetrician and I've delivered a lot of babies, and there's nothing more fun in the world than delivering a baby. And I think that is a universal experience. So Zambian women are just as delighted, just as touched by their deliveries as women are anywhere. We work in the country of Zambia, which is right in the middle of southern Africa. I lived in Zambia for about a decade with my family, and in fact, most of my professional life before I moved back to the U.S. was spent there. So I have a very real and personal connection to the place. My kids grew up there. A lot of my best friends live there, and I love the place. It's peaceful and it's not populous like you might expect from when you think of an African country. Beautiful and green, but the people there suffer from this huge disease burden, and largely infectious diseases. So there's a lot of HIV, there's a lot of other infectious diseases, and birth outcomes. So how well a baby does when it's born, whether it's born on time or prematurely, whether the baby's alive at birth or not, is a huge problem in Zambia. So what we're hoping to do with our site is set up a very carefully monitored cohort of women and their babies so that we can evaluate the causes of prematurity and preterm birth and try to figure out ways to prevent it. We're just delighted to be part of this consortium. This is a hugely important problem, and one that we think that if we put the right minds together that we can solve. So I represent the tip of a huge iceberg which has a lot of talented Zambian and American and Canadian investigators all working together. The site has built a lot of laboratory capacity over the last several years as well. So we have both the clinical and laboratory expertise and basically unlimited patients. There's a lot of babies being born. There's not enough personnel to take care of all the patients, so oftentimes labor will happen in large labor wards whereas in the U.S. you might have one-to-one nursing and you might have one obstetrician for each patient who's in labor. It'll be typical in Zambia for one midwife to be taking care of literally dozens of patients in labor at the same time. I think the average woman in Zambia has between 5 and 6 children. And one of the reasons for that is because the birth outcomes are not great. So you, unlike in the U.S. or Canada where you can pretty much rely on your baby being okay, in Zambia, the likelihood that one of your children will die before the age of 5 is actually pretty high. And so I think that Zambian women sort of invest in numbers by having more babies so that they can have a full family.